Approximately 10 million people have an operation in the NHS each year. Sometimes surgical wounds cannot be closed, or a closed wound may reopen. These wounds are called surgical wounds healing by secondary intention, which means these wounds are left open to heal from the bottom up and from the outside in. These wounds typically take longer to heal than those that have been closed with stitches or staples. The slow healing process hugely impacts on patients' quality of life and daily activities, causing physical, psychological, and social problems. Treatments can be expensive for the NHS. The use of a special type of suction dressing called negative pressure wound therapy has increased dramatically over recent years. Although many people believe that suction dressings are better at accelerating healing, reducing pain, and reducing infection than standard wound dressings, we don't actually know for certain. This trial wanted to find out whether suction dressings help open wounds to heal more quickly than standard wound dressings, and if it's good value for money. 686 patients from around the UK with an open wound anywhere on the body were included. Patients were picked equally and randomly to receive either a suction or standard wound dressing. Information on patients' wound healing was collected: if they had an infection, their level of pain, and whether the wound affected their quality of life. The study did not demonstrate that suction wound dressings healed an open wound any quicker than standard wound dressings. Wound pain and patient quality of life were also similar in both groups. The chances of wound infection, use of antibiotics, return to hospital, or need for further surgery were similar for both treatments. In addition, the new suction dressings were more expensive to use than the standard wound dressings. In summary, the study found no convincing evidence that more expensive suction dressings were better than standard dressings for these open surgical wounds. Further research to manage treating these wounds effectively is important. Thank you for watching.